Mindfulness works just as well as medication to curb anxiety, study finds.
Experimental therapy Gantenerumab fails to slow or improve Alzheimer's memory loss in clinical trials.
Sperm count declining worldwide, study.
Leprosy bacteria able to regenerate organs, study.
WHO recommends skin-to-skin care for preterm babies.
Game-changing type 1 diabetes drug approved in US.
Over 1 billion youth risk hearing loss from headphones, loud music, study.
Arsenal and England's Bukayo Saka pays for 120 children to have life-changing operations.
Mindfulness works just as well as medication to curb anxiety, study finds. A new study suggests that a mindfulness meditation course may be just as effective at lowering anxiety as a typical medication. In the study, which was released on November 9 in JAMA Psychiatry, 276 adults with untreated anxiety disorders participated. Escitalopram, the generic version of the brand-name drug Lexapro, which is frequently prescribed to treat anxiety and depression, was given at random to half of the participants in doses of 10 to 20 milligrams. The other half of the participants were assigned to an 8-week mindfulness-based stress reduction course. The outcomes were astounding. Over the course of the 8 weeks, anxiety symptoms decreased in both groups by about 20%.
Experimental therapy Gantenerumab fails to slow or improve Alzheimer's memory loss in clinical trials. An experimental drug called Gantenerumab did not work for people who had early-stage Alzheimer's disease or were at high risk for memory loss, according to the maker on Monday. The drug Gantenerumab belongs to a group of injected medicines used to clear the brain of beta amyloid, which is a group of sticky protein fragments. Alzheimer's disease is characterized by beta amyloid buildup. While the majority of these medications have cleared beta amyloid as intended, many have failed to show any real-world benefits to patients. Their brain function and memory don't significantly improve despite treatment.
Sperm count declining worldwide, study. A significant new study released on Tuesday found that the global sperm count of men is declining quickly after having decreased by half over the previous 40 years. The study urged intervention to halt the decline. Israeli epidemiologist Haggai Levine's study, which has been criticized for only including data from North America, Europe, Australia, and New Zealand in 2017, has been updated. The new study is the largest meta-analysis on the topic, containing information from more than 57,000 men gathered from 223 studies in 53 countries. It confirmed the 2017 finding that sperm counts have decreased by half over the past 40 years with the addition of the new countries. Furthermore, data suggests that this worldwide decline is continuing in the 21st century at an accelerated pace, said the study published in the journal Human Reproduction Update. According to the study, sperm counts are declining at a rate of about 1.1% per year. To stop further disruption of male reproductive health, more action and research are urgently required, it was added.
Leprosy bacteria able to regenerate organs, study. Researchers at the University of Edinburgh believe that leprosy bacteria may hold the key to safely repairing and regenerating the body. The remarkable capacity of the bacteria to almost double the size of livers by promoting healthy growth has been discovered through animal experiments. By doing so, the bacteria have more tissue to infect, which is a sneakily selfish act. But the scientists say that figuring out how they do it could result in brand new age-defying treatments. When leprosy infects the skin, eyes, and nerves, it results in disability. Throughout time, those who were infected were avoided. However, the bacterium that causes it, Mycobacterium leprae, has other peculiar characteristics that fascinate scientists, such as the capacity to engage in biological alchemy, changing one type of bodily tissue into another.
WHO recommends skin-to-skin care for preterm babies. For preterm infants, the World Health Organization advises kangaroo care, also known as skin-to-skin contact. The new WHO recommendation represents a significant departure from earlier advice and accepted clinical practice. It also reflects the enormous health advantages of ensuring that mothers and their preterm babies remain together after delivery, according to WHO. The new recommendations are intended to increase survival and health outcomes for infants who are born before 37 weeks of pregnancy, or who are less than 2.5 kilograms at birth, according to the Global Health Agency. Due to their lack of body fat, preterm infants frequently struggle to regulate their body temperature when they are born and frequently need medical assistance breathing.
Game-changing type 1 diabetes drug approved in US. Regulators in the USA have approved an immunotherapy drug that has been shown to delay the onset of type 1 diabetes. Teplizumab, according to experts, ushers in a new era in medicine by attacking the disease's underlying causes rather than just its symptoms. It functions by restructuring the immune system to stop attacking insulin-producing pancreatic cells inadvertently. It will probably open the door for approval decisions in other nations. Around 8.7 million people worldwide have type 1 diabetes.
Over 1 billion youth risk hearing loss from headphones, loud music, study. A thorough review of an available research on Wednesday estimated that approximately 1 billion young people worldwide may be at risk for hearing loss due to using headphones or going to loud music venues. The World Health Organization-led study urged governments and manufacturers to take more action to safeguard future hearing, and urged young people to be more cautious about their listening habits. More than 19,000 participants aged between 12 and 34 were included in 33 studies that were published in English, Spanish, French, and Russian over the past 20 years. The analysis, which was published in the journal BMJ Global Health, examined data from these studies. It was discovered that 24% of young people engaged in risky listening habits when using headphones with gadgets like smartphones. Additionally, it was discovered that 48% of people had experienced unsafe noise levels at nightclubs or concert venues. According to the study's analysis of these results, between 670,000 and 1.35 billion young people may be at risk of hearing loss.
Arsenal and England's Bukayo Saka pays for 120 children to have life-changing operations. In a remarkable act of kindness, Bukayo Saka paid for 120 Nigerian kids to receive life-changing surgeries. The 21-year-old Arsenal winger, who led the Gunners to the top of the Premier League standings, is gearing up to play a significant role for England at the World Cup. However, the fan-favorite kid has made time to assist children in Nigeria, from where his parents immigrated to the UK, who needed major operations. Saka teamed up with the charity Big Shoe, which has the support of celebrities like Paul Pogba, Mesut Ozil, and Philip Lahm, to help kids in Kano, Nigeria's second-largest city. For your daily global health news, visit www.StayWellWorld.org. Please do well to subscribe, like, share and comment. If you've already subscribed, turn on the notification icon so you don't miss any update. Thank you for watching.